Good morning, Peter Goertz. I'm a psychiatrist. I want to talk to you about two patients I saw this past week. Both were quite challenging for me, and I was wondering, did I make the right decision or not? So the first one was a paranoid, psychotic patient who felt he was being poisoned and brought himself to the emergency room. And I did not feel ultimately that he required hospitalization. He was very clear on saying that he did not want to hurt anyone or himself. And he was pretty stable in his life with a job and family. The second patient was a demented patient, didn't know the month, was maybe not quite clear exactly on what medicines and doses she was taking. But she was also adamant that she was satisfied with the place to stay she had and that she was comfortable in the community. So ultimately, also with her, I felt it was not necessary to hospitalize her. Again, with both patients, I was wondering, did I make a good decision or not? So bottom line, in the state I practice in, if you want to detain someone against their will psychiatrically, they have to be dangerous to themselves, dangerous to others, or what we call gravely disabled, not able to take care of themselves, feed themselves, things that are very basic. Now, that's on paper. If you're at home with someone who may be dangerous or not able to take care of themselves, that may not be black and white. So let's say your husband is very paranoid, he's really on edge, it looks like he's about to assault you. You could call 911, so call the police for what we call a welfare check. But if your husband, when the police get there, is cool, calm, and collected, very relaxed, the police may say, well, he seems fine, we can't just take him. So that's one potential problem. And in that situation, in our state, you would need to go to the coroner's office then and get what we call an order of protective custody. So what we're looking at is a time course, progression over time, but all we can look at a given evaluation is the current time. So let's say with the demented patient I mentioned, is the patient driving? That could be dangerous. This patient was not driving. Is the patient living alone? Could be dangerous. Is the patient leaving the stove on, walking outside naked? Those are all questions. So at the current time, none of those were concerns for my patient that was demented. But again, that could have changed, down the road in a week, 2 weeks, 2 months. So things can change over time, but all we can do during a given evaluation is evaluate the current time. With a paranoid patient down the road, he may have might get so paranoid that he wants to retaliate against people who he feels are poisoning him. He may even want to kill himself before other people kill him. So paranoid patients can get dangerous. Again, that was not my perception at the current time with this patient that I saw, but things can change over time, and you definitely want these patients observed, monitored, let's say by family, and if things get worse, you can take it from there. So bottom line, what we're doing is we're balancing freedom with safety of the patient and public safety, and that can be a delicate balance, and in every case, it's a judgment call. Thank you.